Welcome to the Social Workers radio talk show on WCDB Albany 90.9 FM with co-hosts Dr. Eric Hardiman and Alyssa Lotmore. Here at the Social Workers, we address issues important to our communities with social work students, alumni, and community partners as our guests.
As part of the University at Albany School of Social Welfare, we hope to take social work beyond the classroom and agency settings and directly to the public, because the public is the client. Catch us on air, online, and anytime. Welcome to the Social Workers Radio Talk Show. I'm your host, Alyssa Lotmore. My usual co-host, Dr. Eric Hardiman, couldn't be with us today. So it's the end of the semester, and that's usually the time when we have a lot of student guests on who talk about their end of year projects or capstones. And today is one of those days. We had a small group of MSW students who completed a media project as part of their field internship, where they recorded their own podcast episode on a topic of their choice. So today we are joined by a first-year MSW student, Alyssa Rodriguez, who will talk a little bit about that podcast hosting experience and also share her episode. Welcome to the show, Alyssa.
Hi, thanks for having me.
I love the name, by the way.
I know. We spell it the same too, which is great.
Yeah. So let's just jump right in and briefly tell us a little bit about yourself and what brought you to UAlbany as a social work student.
Yeah, so my name's Alyssa. I actually graduated SUNY Albany in 2018 with a degree in psychology. And after that, I immediately hit the ground running and started a job working in foster care through Berkshire Farm. I've been working there for 3.5, almost 4 years. And yeah, so I decided to come back to pursue my degree in social work, to be able to sort of expand my reach on helping kids. And, I want to continue working with kids and specifically their mental health. And so the topic of my podcast is related to that, related to what I do at Berkshire. It's about mental health programs for kids, not just while they're in care, but specifically when they are reunified or even before they come into our care, before they are removed. And the guest that I had was a good friend of mine. Her name is Liz. She is a clinician in one of our local ROTC programs, which is a type of foster care that is a little bit above what I do in terms of levels of care. But yeah, she's been doing that for a little over 4 years, and we're both passionate about helping kids and helping kids be able to sort of be stable and meet their goals while also helping them return home.
No, it's such an important topic. And my MSW internship when I was a student was also in foster care. And it was something that I still hold near and dear to my heart. It's an important area of work. And it's something that I don't think the general public know a lot about. I mean, they know that there are children in foster care, but I really don't think they know the ins and outs of the system, which leads me to my next question about, you sort of went into why you chose the topic, but do you feel that there is a need for the public to get more information about foster care so they have a better understanding of how the system works, what the needs are of the children, and what the social workers do?
Yeah, absolutely. I think you touched on it great, where I do think I share that, where the public doesn't really know. I mean, they have like a general understanding. I mean, it's a lot of the times like this shows up in like movies and TV shows, but it's never really explored to an extent of exactly what that day-to-day looks like, what, how many kids are in care. Because that's another thing, is I feel like people think that there are less kids in care than there are. I mean, I think the number I had was like 36,000 children that are somehow involved in the child welfare system, whether it be reports, whether it be being in care itself. So it is something that, and that's in New York alone. So I do think that it's something that affects our kids day to day and affects the kids just in our community and helping them and the families, not just the kids, but the families too. And foster care isn't really focused on a lot. And I do think that's because the public isn't really, talking about it, and there aren't like there's a lot of advocacy when it comes to social workers and what we do. I think we focus on it a lot, but the day-to-day person, they don't really think about it because it may not affect them, or they might not just be exposed to it. So I do feel that talking about it and giving more resources to the general public is important in raising the awareness of, what the needs are, because we do have some great programs while in foster care. But once kids are reunified, or once they're out of foster care, they're really like, the need is still there. So there's not a lot of resources available. So I do think that it's important for us to sort of discuss that, and maybe, in doing so, we can elicit change and be able to sort of broaden those resources and broaden the reach that we can have on these kids who, might come back into care because they don't have the resources needed.
I completely agree with that. And what part of my internship was working with the students who were about to age out of foster care. And it was hard for me because I didn't really see as many resources as I would have felt comfortable with being able to send a child out, I guess now an adult, out on their own, where they've been in a system for so long. So I think raising the awareness about the issues and needs and how to best support these children as they grow into adulthoods, if they do age out of the system, how to best support them.
Yeah. And teenagers, like you said, real quick, teenagers, it's even less than just like normal resources. Like, there's even less resources for teenagers out there versus like the general public. So yeah, definitely.
Now, you mentioned getting that message out there to the general public. And what has this experience been like for you? When you entered the MSW program, I'm sure you expected the social work component, but maybe not this media component and communications component. So how has this experience been like, not only to record your own podcast segment, but to also be here right now being interviewed about it?
Yeah, so I think it's, it's been a good experience. I love podcasts. Honestly, I drive a lot for my work. So I listen to, I think I have like 6-7 podcasts on rotation right now. So it's something that I'm pretty familiar with in terms of being like a listener. So it was interesting to sort of be able to see how planning for an episode and then recording an episode, and then, and like that coordination, I think that was a big important piece of it, where the coordinating was good to sort of get that experience, because that's a lot, social workers, that's kind of all we do is coordination, and being able to like plan with people and being able to set things up and make sure things run smoothly. And also, being able to do the research on this topic that I've been sort of just immersed in for almost, half a decade now. It was opening my eyes to sort of like the specifics and the resources available out there in terms of being able to get information out there and being able to sort of access those things. That was interesting for me as well. I found some useful websites and useful things that I can use in the future. So yeah, it's been overall, I think it's been a good experience, and just putting it together. It's been good, I think, overall.
And you've gained some knowledge about how to best navigate this field of communications and getting that message out to the public. So from writing an op-ed to being a guest expert on a panel, there are many ways that social workers can be media savvy. And looking ahead, do you think you will continue to use the media to reach more members of the general public about the social work issues you care about, particularly foster care?
Yeah, I can definitely see myself using this in the future, even sort of like being a guest. I was thinking about like, touching, because there are some like foster care podcasts out there that are talking about these things, like specifically when it comes to, because that's what I also found in my research, that there are podcasts that are talking about the child welfare system or talking about issues in social work beyond, the one that I'm on now. So I think that there is a lot of opportunity for that. And especially with Zoom sort of that's how we get things out there, and we record way more than we did before. I think it's just sort of becoming social media and technology is just becoming a part of the norm and being able to get that information out there. So I definitely see myself doing this in the future.
And I think it can also be a resource to prospective individuals interested in becoming foster parents to find out more resources and being able to connect. Because that's something that's been more familiar to me, or some more of my friends have been becoming foster parents, and they've been finding out about things by attending Zoom sessions and meetings where they were being able to talk to other foster parents about their experience. And it was things that maybe if they had to go out to a meeting at an agency, maybe they might not have stumbled upon it versus having an online access to being able to find out more about this process and having some of those questions answered and some of the myths and, how what this experience is actually like, being able to answer and find more comfort to be able to move forward with that process. So I think the online technology piece has been really, I don't know, I mean, you work more in the field than I do in this area right now, but I think from what I've known from personal interactions, it seems to be helpful to get that message out there to different groups of people, different audiences.
Yeah, absolutely. Yeah, the information sessions, and then also what we call our MAP classes, which are the classes you take to become a foster parent, have been online as well through Zoom. So that makes it a lot easier to even be certified as a foster parent. So yeah, it's been overall challenging with COVID in terms of everything, but when it comes to like the technology piece, I do think we can outreach more people.
Yeah. So up next, we're going to listen to your interview that you conducted. Is there anything you would want our listeners to know before we transition to your interview that you created?
Yeah, so, I did mention some resources about towards the end about where you can go to find more information about, the different programs when it comes to children and mental health and care, if you're interested, but also just throwing it out there, if you're interested in foster care, learning more about it, or even about being a foster parent, you can always go to the Berkshire website. We're constantly holding meetings, and we're constantly holding sessions for prospective foster parents. So yeah, if you want to go to berkshirefarm.org and see the latest session parents.
All right. Well, with that, I think we're going to transition to your interview. I want to thank you so much to our listeners. Again, we were joined by Alyssa Rodriguez, who is a first-year MSW student completing her media project for her field internship, where she created her own podcast. So we're going to switch to that next. So stay tuned.
Hello, and welcome to the Social Workers Radio Talk Show. This week, me, Alyssa, and my guest, Liz, are going to be talking about mental health and children in foster care. Hey, Liz.
Hey, Alyssa, what's up?
Nothing. How are you?
Great.
Liz is a licensed mental health counselor, and she's been a child therapist in a residential treatment program for over 4 years. Before we get into our topic, I just want to, hear a little bit about our guest, about, her background and sort of, her interest in our topic. So, how did you get into working with kids? How did you get into the program that you work?
Yeah, so I started working in foster care over 5 years ago. I had an opportunity. I was in my first year of grad school. I had the opportunity to interview at a local agency. I started off doing case management and then transitioned over to therapy once I was graduated from grad school.
Okay, all right, cool. And what made you want to work with kids?
To be honest, it wasn't the first population I wanted to work with. I wanted to work with adults, but as I got more involved doing case management and working with different counties, it just became more interesting to me, and I felt like there's a lot of work to be done with this population, especially when you are working with populations who have been in the foster care system.
Right. Yeah. And I also want to just, say a little bit about myself. Like I said before, my name's Alyssa, and I am a first year student in the social welfare program at UAlbany. And I also have been working as a case manager, but we call it family specialist, for almost 4 years now in foster care. And I've also been working closely to help meet the basic needs of our kids in care, as well as their mental health needs, which is the topic of our conversation today, is about mental health, and specifically mental health programs for kids while they're in care, and specifically when they reunify, which is always the goal with kids in care. The goal is reunification of the biological parents or resource. And a lot of the kids that we see in care have these mental health needs. I know in our program, all of our kids receive mental health services. I believe it's the same in your program, right?
Yeah.
So it's definitely an important thing while children are in care with us. But then the question is, once they're out of care, what does that look like? Do they receive the same services? Do they not? And how does that affect their returning back in care or even going into care? So I do just want to, give some statistics about foster care in general and about the child welfare system, because it's all encompassing in New York, and it's something I feel like a lot of people don't really think about, and think about how many people are actively in foster care. So in 2020, there were over 6,000 kids that came into care in New York, and that added to the 36,000 kids that are involved in some way in a maltreatment or child abuse indicated CPS report, which is how all kids come into care. And the recidivism rates of kids in care in the span of 24 months is almost at 13%. So a lot of the kids that we do see that discharge, they come back into care. So that's about 6,000 kids who reunite with their parents, who discharge in some form or other, usually either reunification or adoption. So Liz, can you tell us a little bit about the services that you provide to these kids while they're in care?
Sure. So as a child therapist, I would usually see kids weekly, usually about a half hour, depending, certainly if a child has had some issues, if they've made any statements of harm, wanting to harm themselves or other individuals, I would certainly assess them, identify any safety risks, if there needs to be a higher level of care provided to them, for instance, if they need to go to the hospital or anything like that. A lot of it too is working with families, providing that family therapy, connecting with their providers, whether that be a county worker, other service providers, and also just providing them with the opportunity to, one, express themselves in a safe environment, because there are children who don't always have those opportunities, and as well as identifying appropriate coping skills that they can use during stressful times, just in their everyday life.
Yeah. And so it sounds like you do a lot of work while they're in care. And I know that typically when it comes to kids in care, they have a whole team behind them, like clinician and case manager. There's also, like you said, the county worker. And a lot of the times there's also prevention programs, and there's CFTSS services that might be put in place, which is another support system in the home or residential treatment facility. either way, that sort of provides that extra level of support for the kids and works with them within the home setting. So it's a lot of the times with kids in care, they have a whole, and families, not just the kids, but the families have a whole support system while they're working for unification. So I know a lot of what you do too, since, your program. Actually, let's backtrack a little bit. I don't know if we really got into the RTC and like what exactly, like the time span, like how a kid is qualified for that. So how about we do that basis, and then like we can talk about discharge and all that good stuff.
So under Office of Child and Family Services, when you have a child going to foster care, there's different levels of care that the child may end up in. The goal is always to have the child at the lowest level of care, that they are safe and that individuals around them are safe. And sometimes, unfortunately, for kiddos, they may need a higher level of care. So a residential treatment center, or RTC, that's going to be your highest level of care under the OCFS program. So they may have secured doors, you may have a higher number of staff and ratio. Excuse me. So that may be for your children who have a tendency to run away or run out of program. These may be children who just haven't been able to identify appropriate coping skills. So they may act out physically or verbally aggressively to peers, staff, adults. These might be your kids who just really struggle overall, and so you might start them off at the residential treatment center, RTC level of care. Then there's a group home level of care. So one thing that I can kind of identify in our program is the group home level of care. Obviously the door is locked, but they're not secured the same way at the RTC level of care. And you don't have as many staff in ratio. And then you also have the foster home level of care. So children are in certified foster homes. And that is the lowest level of care, at least the program I work in, before they would discharge home or to the permanency resource. Yeah,
and so like the goal of, and correct me if I'm wrong, but the goal of sort of like the RTC level of care is to bring them down a level, which I guess is always the goal, because going home, reunifying is considered a lower level of care. So I guess our goal is always to go to that lower level of care, but with foster care, the lower level of care is reunification. With you guys, the lower level of care is that group home or foster care, correct? So is that what you're working towards?
So it really just depends on the county. I've worked with a lot of different counties throughout New York State, so I've had kids who will be placed at the RTC level of care, and then they've done the work and families have done the work and they'll just transition right at home. Then sometimes, we may take those additional steps of let's step them down the group home or step them down to foster care. I think every situation's unique, so it's not going to look identical, and it really just depends on what the plan is with the county and the other providers involved.
Right, yeah. Yes. So when it comes to that, because it is, a process, and getting, again, the goal is discharge. Kids aren't supposed to be in our care for long. And there's a timeline all for that, but we could do a podcast for hours on that. So we're going to keep it simple about, just the programs. So when it comes to discharge, because I know that's one of your goals is discharge. So the question that I wanted to ask was about timeline. So what is the population you serve, and like how long can a child like remain in your program?
Sure. So I have worked with kids as young as 4 and as old as 13. Ideally, I think my range right now, I think I'm around 8 to 13 year olds right now. It really, again, I think it just depends on the situation. So I may do diagnostic assessments, and the kid may be with us for 3-4 months. Like, they were truly just there to get that assessment done, and now that we have the recommendations in place, they are going to move forward in whatever direction that may be. Other times too, I've had kids who have unfortunately been there for a year plus time. And it may just be, the child just is not there yet. It might just be some circumstances with the family. Ideally, I think, we don't want to keep a child in placement for too long. I know that's something we're both very passionate about.
Yep.
Yep. Sometimes it's just the circumstances within the case, so they might stay a little longer. Ideally, it might be a year or so. We certainly, the other issue you have is you don't want to push kids too far along and then just end up in the cycle of coming in and out of care.
Right.
And so we really want to make sure that, one, the child has the coping skills needed, and also that the family is able to process it and they have the supports that they need. And unfortunately, sometimes that does take a bit longer.
Right. So have them build those skills, have the children, build the skills and being able to sort of return home, because it can be a transition. And, the beginning, when they go home, that's sort of the most rough time with the families. Once, it's a good transition, but it's not a transition, and kids can have issues with that, and sort of, especially when there's those mental health needs that we're talking about today.
Absolutely.
So I know that you always have a hand, with your kiddos, you have a hand in that discharge and being able to identify those discharge resources and sort of be a part of that to make sure it's what we call a planful discharge, and make sure that they have all those resources that we talked about to avoid reunification. So what does the discharge process look like, and what have you found? What's your overall experience with it?
Yeah, so I think one thing too, and I guess I should have mentioned this in the beginning, so I do apologize for that. But in addition to me seeing kiddos weekly, I am responsible for a meeting to happen essentially once every 3 months, so about 4 times a year. For anyone who works in foster care, they're familiar with the service plan review, and that takes place about every 6 months or so. So ideally, twice a year, a kid's service plan is reviewed with county and service providers. Where I am with my program, we do an additional 2 meetings. So about every 90 days, these kids, we look at their case, we look at their strengths, we look at what we need to continue to work on, and that's where we really do get to look at that timeline of, what makes the most sense. Another thing we like to look at too is, are there any natural breaks that are coming up in the near future? So for us, a lot of times, if a child is doing well and they're having really good visits with either the parent or the permanency resource, it might make sense to do a visit or a trial discharge, like the Christmas break or the summer break or spring break, things like that. So we try to look at what makes a natural break or what makes sense. Also too, because this just gives the permanency resource an opportunity to register the kid for whatever school they identify.
Yeah, if they transfer schools or,
exactly.
And even if it will take them some time to, like we said before, get comfortable in the home and be able, because you can also see school disruptions too as being triggering for kids.
Absolutely.
And
it also
definitely.
too, giving the child an opportunity to process the discharge. We always want to make sure the kid is aware of what's going on. It certainly is such a happy time for a kiddo when they're able to go back to those permanency resources.
Yeah, right.
But I've also seen kids too just get really anxious because, the program that they've been involved in for how many months they're not involved in anymore, and you have that anxiety too. Another part for me, because I am the clinician, I need to make sure that there is a mental health provider available. So Ideally, if I'm doing individualized therapy with a child, I will make the recommendation, or I will try to find a provider for that kid so that they have a continuation of care. Also, just trying to find if there are other therapies involved, so family therapy or trauma therapy, making sure that those providers are set up before the child leaves, so we don't have any gaps or any pauses in that continuation of care. And a lot of times too, we have community-based programs, and so a lot of times I find myself, when a child is returning home or returning to that permanency resource, I find myself making a lot of referrals for community-based programs.
And so tell me about that, because that sort of goes, nicely into our topic of today, which is essentially mental health and what mental health services are available to kids while they're not in care. Kids that are, at risk of being in care, or kids that have reunified with their parents. Because so when a kid is in care, they have a lot of resources. Is it the most extensive resource list? Maybe not, but they do have a lot of supports. And they have a lot of the therapies, like you said, your program, it comes with the clinical care, but then it stops. You stop working with the kids when they're out of care. So that's the prerequisite, is they have to be involved in your program, which means they have to be involved in this system in some way or another. Either it be involuntary or voluntary, because I know you get some voluntary placements as well.
Yeah.
And same with my program, where we have a clinical team, we have clinical services, we also have behavioral therapy and family therapy. But it's that caveat of they have to be in our program, which means they have to be in care. And at this place, in my circumstance, they have to be placed within our specific foster homes. So our foster homes. So there's a lot to it. And once they leave our care, then the services are different. And like you said, like the continuation of care and the changing of providers and all of that. So can you just tell me your experience when you're trying to locate these providers? How is that? Is it hard to find? Is it easy to find? What resources are available for kids when they're out of care?
And I think you touched upon it really well. I think we're in such a unique environment here in the Capital District area, because we do have a lot of programs. So we do have a lot of agencies right in Albany, Troy, Schenectady that is able to do the work. I've worked with different counties throughout New York State, and unfortunately I can't say it's all the same. So you get into North County area and they don't have the same resources the way we do. Talking about the school setting, sometimes kids need a day treatment level of care for schooling. I have had counties from, upstate say the closest day treatment school by us is all the way in Albany. And, so that's where we have some of the programs set up for day treatment schooling. So it really, I think, just depends on the area. I've noticed I don't have as difficult of a time when the kid is from this area.
Yeah.
Again, because I think there's just so many wonderful programs and agencies throughout the Capital District.
Yeah, absolutely.
But when you are dealing with kids up north, or if you have kids out in the west, or even, I'd say central Schoharie Valley, areas like that, where the resources really aren't there, it can be difficult. And that's where you see, I guess, a lot of the kiddos struggle, because they don't have the resources the same way. So it's actually great, because you'll see some programs do programming within the schools. So there might be a prevention team that's through the schools, and that's how they get their outreach.
Yeah, and that's great.
Yeah.
Yeah, and speaking of prevention programs, so there are, because we've talked a lot about discharge, and when it comes to the opposite end, which is preventing children from coming into care, because they're at risk due to neglect or what have you. There are prevention programs put in place that are, the whole purpose of them is to prevent the child from being removed from the family. However, a lot of the time that those programs, you need to already have an open CPS case in order to qualify for these services, which is, and I've always had this thought of, it's a little, that doesn't make sense to me, because the whole point is to prevent the involvement, but they need to be involved in order to get the services. So it seems like a little counterproductive, where these great programs, because we do have, especially in Albany, we have a lot in this area in general, we have a lot of great prevention programs that do amazing work, but they're not implemented until either the CPS case is open or the kids are already removed. So that prevention aspect is kind of out the window. Or that word prevention's out the window. And it's interesting when we talk about sort of that prevention cases and like the sort of the quality, because a lot of this has to do with what kids qualify for and what families qualify for, and a lot of the times they have to have that sort of CPS involvement to qualify for. And what I found is that New York City is actually starting to relax those qualifications, and they are starting to have implemented prevention programs that you don't have to have any child welfare involvement in order to qualify, which is great, because I feel like that, and feel free to like jump in if you have like an opinion on this, but in my perspective, that is letting the prevention programs do their job and sort of opening it more to families that might, like the stigma prevention programs is, well, you're going to take away my kids.
Absolutely.
CPS needs to be involved, and like they're the enemy, and we don't want that in our communities. So you see that stigma a lot when it comes to these prevention programs that could very well like help these families and give them the supports that they need. And they're being hindered by that. So I do think sort of like taking that qualification out of it can expand the program. And I'm really excited to see like how that works, because it's a relatively new program.
Absolutely, yeah.
So I'm excited in the next like couple of years to see how that prevents kids from being removed and families being in like the child welfare system.
Yeah, absolutely. I can't wait to hear about how the programs are going. Exactly what you said is, I think a lot of times with prevention, there is always that worry that there is going to be a removal. I've certainly had to do my work as a case manager and even as a therapist to say, I'm on your side. Like, mm-hmm. I am team family. My goal at the end of the day is not to make sure that you surrender or your parental rights are terminated. I want this kid to come home to you just as badly as you want this kid to come home to you.
Yeah.
And you really have to do a lot of that work and building
mm-hmm.
that rapport and building that trust. So I think this is a great way to, for those families that are scared to reach out and say, hey, I need this help. I think this is a great opportunity mm-hmm. for them to not have that worry that if they do that, their child could end up in care.
Yeah, and I think you just hit on something extremely important, which is families reaching out for help, but worrying that their children will be removed because of it. Because we do see that where families do like reach out to social services, because that's the main, way of getting all the assistance and in these services, or in even that the CFTSS referrals, which is the Children and Family Treatment Support Service, which I mentioned earlier, that also you need to put in a referral for social services and start that process, unless there's a private, like I know that MVP has their own CFTSS program as well. So if you're under their insurance, you can qualify for that as well as Medicaid. But what if it's just like those general services, you have to go through social services, and a lot of people are terrified of their kids Absolutely. Being removed if they do that. So I do feel like that's a big deterrent. And if we can separate these programs away from that and away from the whole child removal aspect of it, and sort of like put them as their own thing and their own not private, but their own separate entity, which is essentially what they are. I mean, they're contracted, and that's the other, I think, the reason why they need to have an open CPS report is because a lot of them are contracted through the counties.
Yeah.
And that's another like issue about prevention programs and even our programs being the quote unquote bad guys and being on the side of removing kids because we are contracted under county and we're contracted under social services. So that has like a whole other sort of layer of complexity when we are providing these services, where it's, yes, we're providing these services and we want to advocate for the families, but if that goes against what county wants or what county's recommending, then we have to sort of navigate that. Which is why I feel that these programs should be sort of like the option of these programs be separate from that whole process so we can sort of like mitigate those issues. And like I said, New York City is doing, they are putting a lot of things in place to see how it goes and to help families, prevent them from being within the child welfare system and prevent them from going back. So is there anything else that you'd like to mention? Because our time is wrapping up. So like, is there any other sort of like issues you want to address or anything you want to add?
No, I think this is a growing opportunity. I think that there's been a lot of great steps in terms of child welfare and child advocacy. I'm really excited about what New York City is doing, and I can't wait to see how that turns out and hopefully how it expands throughout the rest of New York State.
Yeah, definitely. And we all know that most things start with New York City and then they sort of trickle upwards. Because, there is a lot going on in New York City and they do have the largest population of kids in care. So there are a couple, and if you're, as a listener, interested in sort of learning more about the child welfare process, specifically when it comes to mental health services that we spoke about before, we do have, I have a couple of resources that you can look into. The National Center for Children in Poverty, they are based in New York City, but they span across the state, providing sort of information regarding things to do with children, not just in poverty, but also the child welfare system. They keep up to date with what's going on and about, all of the different resources that there are for families and sort of like policy-wise what New York is doing to address these gaps in service and these issues. And then if you are New York City based, there's also the New York School Center for New York City Affairs that is specific to New York City, and it talks about like a whole range, and it works to change policy for a whole range of issues, education, poverty, medical, all of that. But they do have a whole child welfare section where they specifically work to change the policy to aid families who are dealing with the child welfare system. And again, that's a great resource to sort of see what's going on in the city and actually hear about, these programs that are happening in real time. So yeah, thank you so much, Liz, for speaking with me and speaking on this subject. Always great to talk with you. Thank you all so much for listening, and I hope everyone has a great night.